A deadline passed, and now almost 100,000 people across mid-Missouri can't use their insurance at their primary care providers. Today, we're taking a closer look at what went wrong in the negotiations between Anthem Blue Cross Blue Shield and MU Healthcare, what patients can do now, and if a deal will ever be reached. We begin our story in Jefferson City, where a standstill in negotiations has put a standstill on one couple's hopes for new beginnings.
I feel like it's more profit over people, and for both hospital and insurance, it needs to be like the people. The people have to come first.
Amanda Madison and her husband live in Jefferson City. She says they have Anthem Blue Cross Blue Shield insurance, and we're seeing MU Healthcare doctors with plans to start a family.
I just saw an OBGYN literally last week, and I immediately love her. I even wrote a review about her, saying okay, she made me feel so comfortable.
But after MU Healthcare and Anthem failed to reach a deal, Madison will have to pay out of pocket to keep seeing her.
To go from that to I may have to change to a different hospital, change to another OBGYN who I may not possibly, get along with. That's kind of scary.
I have a number of chronic conditions that I feel very secure with the providers that I have.
In Columbia, Mary Lou Oliver is also insured through Anthem. She's been seeing MU Healthcare doctors for about 20 years, and switching providers isn't an option for her.
My neurologist is the only one that does a particular procedure that I need for a chronic neurological condition I have.
Conditions for a contract extension between MU Healthcare and Anthem Blue Cross Blue Shield fell apart last Monday. Midnight on March 31st was the deadline. Earlier that afternoon, MU Healthcare released a statement from CEO Rick Ransom blaming Anthem, saying in part, quote, "In our last offer, we made reasonable material concessions as a means to expedite negotiations in the best interests of our patients. However, Anthem showed no willingness to move forward." However, Anthem representatives claimed it was MU Healthcare who rejected offers and canceled meetings, causing the deal to fall through. That same day, Stephanie Wojcicki, the president of Anthem Blue Cross and Blue Shield in Missouri, sent a letter to Ransom, saying in part, quote, "Anthem is disappointed by you and MU Healthcare's ongoing narrative about our contract negotiations. We have consistently worked in good faith to reach an agreement that ensures access to affordable health care for our members."
It's a game of chicken, basically, is what it is.
Timothy McBride is a professor in the School of Public Health at Washington University in St. Louis. With both sides pointing blame at the other, he helped us gain insight into how contract negotiations likely played out. MU Healthcare is asking for 39% price increases over 3 years.
The healthcare inflation's been below the average inflation rate, around 5%, 3 to 5%. So 39% seems high, I have to say.
Elevance Health, which owns Anthem, has been running these ads.
Where is this money going? Say no to MU Healthcare's outrageous demands.
McBride says the burden of price increases often falls on consumers with higher premiums or out-of-pocket costs. But he also explains hospitals operate on tight margins, so even though they make a lot, they spend a lot too. And MU Healthcare is a nonprofit organization. McBride says insurance companies and healthcare providers negotiating right up to the deadline is common, but this situation isn't.
Usually what happens, I can tell you, is you get to that point and then a deal's reached. It's usually within days of when it expires, but that apparently didn't happen here, so that is pretty unusual, actually.
We don't know exactly what happened in these closed-door negotiations, but we do know that both sides bring their own power to the table. Anthem has over 90,000 members here in mid-Missouri, and those are patients MU Healthcare won't want to lose. But MU Healthcare is uniquely positioned here in this market. They're one of only 2 major healthcare providers here, so for most people, if you're not going to go to MU Healthcare, your only other option is Boone Health. That's not the case in other places.
The St. Louis market, and you don't offer, say, BJC, that's probably 30% of the market or 25% of the market, and you can just go to Mercy or SSM, so you got other choices. But in the central part of Missouri, it's going to be more challenging. So they do have definitely much more power.
McBride explains it's in the mutual best interest of both sides to continue to try to reach a deal, which they can still do even though the deadline has passed. Healthcare providers aren't designed to handle this high of a volume of collection and administrative costs, and patient pressure from both sides could lead to a deal down the line.
They're going to be really surprised. They'll say, wait a minute, I just paid, $50 for this. Now it's $1,000. What are you talking about? So, and that's going to freak people out. And then there'll be a lot of phone calls, and that you don't really want that on either side, the hospital or the insurance company.
Coming up, we take a closer look at how people can continue to receive care during this dispute. We'll be right back. After MU Healthcare and Anthem Blue Cross Blue Shield failed to reach an agreement last week, almost 100,000 people are concerned about how to continue receiving care. Here are some important things to know. Hospitals cannot charge you more for emergency room visits, even if you're out of network. Congress passed the No Surprises Act in 2021, which requires hospitals to charge in-network rates for ER visits, billed directly to your insurer, so you should never endanger yourself or others trying to travel to an ER farther away because of insurance concerns. Also, many Anthem members receiving some of the most intensive care, including cancer treatment and pregnancy care, will still only pay in-network rates at MU Healthcare for at least 90 days through the Continuity of Care plan. People insured through federal employment plans also qualify for continuity of care, including Mary Lou Oliver, whose husband is a retired federal employee.
It was such a relief for me because I was receiving health care that I was afraid I was paying out of network as of this morning.
As the clock resets on 90 days of in-network prices for some, Oliver says she remains hopeful the two sides will come to terms.
I'm really hoping that a contract is agreed upon. I understand that there's still negotiations in the process.
Spokespeople from both MU Healthcare and Anthem Blue Cross Blue Shield have said they're committed to continue negotiating. Amanda Madison wants them to keep something in mind during this process.
I just want these corporations to understand that for them it could be money, but for me it could be, hey, I just want to be a mom. I want to just take that next step just to see okay, can I do this?
A next step she says she's waited long enough to take and doesn't need healthcare disputes prolonging it further.
I feel like it's been put on hold long enough, and I kind of owe it to myself to take that leap.
Many Anthem-insured people are already automatically enrolled into at least a 90-day extension of in-network prices through MU Healthcare. We have resources on our website to find out if you're eligible for continuity of care and how to apply for it. You can find those on KOMU.com.